If we have a patient with a body mass index of 30 to 35, so technically they're clinically obese, there are several different weight loss options available to them. We may choose to do it with diet and exercise, we may choose to introduce weight loss medications, but one option that's available to us, especially if they have some of the comorbidities, as we call it, or the medical consequences of obesity, such as diabetes, or some of the other ones, such as obstructive sleep apnea or heart disease, we might want to consider more rapid weight loss. Now, that might involve a very low calorie diet or even bariatric or weight loss surgery. Now, weight loss surgery is a very, very effective tool for certain patients and it gets rapid weight loss, but it's only effective if we get the right type of patient. Now, it's very important that we remember that bariatric surgery won't necessarily work for everyone. If a patient has bariatric surgery and is either guilty of habit eating or comfort eating in an evening and that hasn't been addressed, then they might end up having problems after the surgery. Equally, if in their diet they're getting lots of calories from liquid forms, whether that's fruit juices, beer, other high calorie drinks, or even foods that can easily be digested into a liquid form like chocolate, cakes, biscuits very quickly, then that can pass through the bariatric gastric band or sleeve or bypass and render the surgery ineffective. And as we all know, if they don't have the willpower to stop after a very small amount of food, then they're going to fall into problems of eating more. And unfortunately, over the years, there's been this myth that the weight loss surgery is a restrictive procedure and will physically stop you eating too much. To a certain degree, that's true, but obviously the stomach is elastic. And if these patients, who some of them have been severely obese and like their food for many, many years, they might find it difficult to stop at an egg cup full of food and might be tempted to have much more and keep eating. Then what can happen is that stomach stretches and stretches until the point where they might regurgitate that food, or perhaps what's worse is it can stretch or pouch a new stomach above the level of the band in the case of a gastric band, or cause problems with a gastric bypass or a sleeve gastrectomy, again rendering the surgery ineffective. So it's vitally important that we address any psychological problems that the patient may have with willpower or comfort eating or habit eating or the type of diet that they have before we entertain the idea of referring a patient for bariatric or weight loss surgery.